Deputy Allen.
Minister, a number of years ago, winter, especially harsh winters, put increased pressures on the emergency departments across the country. Such seasonal pressures on the emergency department, evident years ago, is now an all-year-round crisis. How is it that patients, some very elderly, have to wait for unreasonable and extremely long times in emergency departments, much of it on trolleys, or having to sit in chairs placed around the emergency department? There are many factors that have given rise to this continuous trolley crisis and the crisis in our emergency departments. Among them are issues of capacity and the constant brain drain of highly trained medical staff, that is doctors and nurses. A lack of consultants and the subsequent cancellation of operations has added to this chaos. It is a scandal that we are exporting our doctors to other countries where conditions and pay are better. However, I believe that an important factor in the creation of these crises are poor political decisions and a lack of political will from this and from previous governments to resolve the growing scandals in our hospitals that has allowed the trolley crisis and the crisis in our emergency departments to grow to the point where it is seemingly out of control. Our health system is poorly organised, and where funding and resourcing is not put to good use, it forces a reliance on the acute public hospitals, placing additional burdens onto the shoulders of an overstretched, hard-working and dedicated hospital staff. Poor decision-making has led to a lack of primary health care centres, developing and resourcing community care, which would help alleviate the crisis in the emergency department. All of this gives rise to a systematic failure in our health service provision. It indicates a health system that is not fit for purpose. It indicates a health system that is unable to cope with the population's health requirements. Only recently, the INMO recorded the highest ever number of patients on trolleys. Apart from the hardship of having to lie on a trolley for hours on end, such excessive delays in the emergency department also give rise to additional risks to patients, especially for the elderly and the vulnerable. It would take political will, leadership and proper resourcing to end this emergency department and trolley crisis. Thank you.